Good evening, everyone. My name is Jen Eras. I'm the lead analyst for the Child Care Assistance Program team. I'm here with a couple of my coworkers who will be helping out and taking notes today. So, Tara and Alma, do you want to introduce yourselves?
Sure. Good afternoon. My name is Alma Amador, and I am a child care policy analyst with the Department of Early and Learning Care, DELC, and I am here to take minutes. Welcome.
Hi, everyone. My name is Tara Valentin, and I'm also a child care policy analyst on the team. So welcome.
Hey, and first of all, just want to thank you all for taking the time out of your day to join us and to go through these rule changes. We look forward to getting into some of the information with you. We'll be marking down everyone's information for your attendance. That'll be important for the reimbursement that will come later. And we'll just go over, these are the main topics for tonight. So we're doing our welcome and attendance. We'll go over a review of the group norms of what the expectations are for tonight, and then an overview of our Oregon administrative rules that will be changing for effective January 1st. So that's what the OAR is, the Oregon administrative rules, and then we'll have a closing and some comments during that time. So with the Rules Advisory Committee, these are for the employment-related daycare program specifically. We have rules advisory committees for different programs, different provider types, and things like that. So this is very specific to the employment-related daycare program, which is one of our biggest child care assistance programs that we have here in Oregon. So for the group norms tonight, we're looking to essentially bring an equity-driven perspective and approach. We're hoping to be centered on children, families, and early learning professionals, asking everyone to just stay curious and welcome other points of view, seek first to understand and then to be understood. Please ask you to stay present. I know I was checking my noise suppression on mine because my dog was barking earlier, so I'm hoping that won't bother you, but there are settings where you can change the noise suppression if there's any background noise happening. We ask everyone to just be respectful with your words and be aware of the power and privilege that happens within this group. And we are planning to start and stop on time and honor your time. And so we will move things along if they need to be moved along. And we are planning on ending at 7 today. So for today, we will be going over 5 different rules that are being changed effective January 1st, and they cover a variety of different things. Some of the rule changes that we've been doing in the last couple of years have really been to try and bring clarity to the rules and bring them into just a language that's easier to understand. Just as a little bit of background for our rule set, most of these rules, or actually all of these rules, were pulled over from a different department's rules. So when our program was over at the Oregon Department of Human Services, all of the rules were interconnected with other program rules, like with the SNAP and TANF programs. And so they are a fairly new rule set. We brought them over July 1st, 2023, and we have been finding some areas where maybe things weren't worded correctly, or they could have been worded better. And then just going through and making other changes as needed. So you'll see a mix of those. There's some where there are definite changes that are needed, and then other things where we're trying to add clarity or essentially do cleanup on the rules. But we'll be talking about our the wait list for ERDC. I'll just refer to them by their last 4 digits since the first ones are all the same. But that's the 0010 is a waitlist for ERDC. 0024, these are verification requirements for the ERDC program. 0030 is general financial eligibility for the ERDC program. And then 0075 is childcare eligibility. So, and this has a lot of different things in it. There's childcare eligibility, the standards, payment rates, payment limits, and payable hours. So there's a lot of things in this rule. We're not changing all of those. That's just the main title of the rule. And then we'll also be talking about 0076, which is our high needs child care payments rule. And so jumping right in, and I won't be able to see the chat, so I am asking my colleagues to keep an eye on the chat. You can always raise your hand too, but I'll just go through the the general description of this, and then we can have more conversation as that goes along. So in 0010, this change, it essentially says when what needs to be done in order to activate the wait list. So we've got a wait list for the ERDC program. It's been in place for about 2 years now. But essentially, the way that this is currently written is it basically says the wait list is either on or off. We have a few, we call them exemptions, or you may hear them called bypass reasons. So we have some reasons where families can kind of skip that wait list and still get onto the program. But the way that the rule is written, it essentially says that all of those exemptions are either in place or they're not in place. They all kind of come together as one package, I'll say, when we implement the wait list. And essentially what we needed to do is we have to move forward with looking at making those bypasses for the wait list something that can be individually turned on and off. So the wait list may be implemented, but we may not have all of the bypasses that we currently have available today. So just to let you know what the bypasses are, our current bypasses are for families who are reapplying for ERDC. So if they've had ERDC within the last couple of months, they can reapply and they don't have to go back on the wait list. We have a bypass for families who have either recently received TANF benefits, and TANF is a temporary assistance to needy families. That's the cash benefit assistance through Department of Human Services. So they've either had to have received that in the last 3 months or currently be receiving it. Similar time frame for a program that's a grant program for domestic violence survivors. So it's called the Temporary Assistance to Domestic Violence Survivors Grant. If an individual has received that in the last 3 months, or they've currently been found eligible for it, they can bypass the ERDC waitlist. And then the other ones that we have are if a child is being placed into a contracted childcare slot. So we have a few contracted slots throughout the state through either Baby Promise or through Head Start. And those rely really heavily on families being able to be onboarded through the ERDC program. And so we have a bypass for children that are being placed in one of those contracted slots. And then our final one is an exemption that child welfare workers can actually give to a family. So if they have a family where childcare is necessary for a child to either be remain in their home, be returned home, or to be placed with a known adult, they can give a referral to have that family bypass the wait list. So as you can tell, these are all very vulnerable populations. They have bypasses or exemptions to the wait list because they're considered very vulnerable populations. But where the ERDC program is currently is that the wait list has been implemented for almost 2 years now. At the beginning of next month, it'll be a full 2 years that it's been implemented. And the caseload has remained pretty static at around 16,000 families. And in the past, the wait list has always worked to decrease the caseload so that we could stay within our budget. So since the caseload is not decreasing, we're not able to stay within our budget. The legislative session, during the last few legislative sessions, they've asked us what it would look like if we turned off some of these bypasses independently. And we essentially had to say that we didn't have a mechanism to do that. But we are building that functionality into the system. It'll actually be in the system next month, but these rule changes would make it so we would actually have authority within the rule to change those bypasses, whether they're an active bypass or an inactive bypass, which is essentially what these changes are. So, and this is not something that, just to put this out there, this is not something that DELC would do in a vacuum. We don't really want to turn any of the bypasses off, but if we had to, it would be something that there would be a great deal of input, or it would be essentially mandated by the legislature if we needed to turn it off. So that's the reason for this change. I have to say this is not a very fun rule change to look at, but just wanted to see if there are any comments or questions. I don't know. Oh, there is a hand. Annalise?
Okay, so I have a question and a comment.
Yeah.
The question would be that our membership, our executive board of our local, and about a dozen parents that we polled quickly in anticipation of tonight's meeting. The question is, if it's the intention of the state of Delk to be able to discretionarily, well, exercise its own discretion to implement or turn off exceptions or exemptions, is Delk changing this rule with the intention of making a change in the next few months? And if Delk is going to exercise discretion, how much notice will people get? Because parents, particularly, and some providers were very concerned about not having enough notice, about there being chaos, about things being turned on and then being turned off and then being turned back on. And that because these groups are very vulnerable, that there would be significant impacts and a trauma chaos caused by not having notice, and really about equity issues, issues of, I guess, for lack of a better word, fairness. So, yeah.
I can say that it's not our intention to be turning these on and off quickly or in quick succession to each other. The intention of this is really that the legislature has asked us what we could do to try and bring the program within budget, because the program is currently set to be overspent this biennium. The wait list itself is not functioning in a way to control the caseload as it had in the past. I say that and that sounds bad, but it's not working because the wait list used to control the caseload by attrition. Like families would lose eligibility because we didn't have strong 12-month eligibility protections, and we closed cases for a lot of different reasons, including if a family couldn't find a provider right away. So as we strengthened those, it made the wait list functionality not work very quickly or very well. I'm sure I don't know that we have a communication plan just yet on what it would look like if we are going to move forward. Like I said, it would most likely be due to legislative action if we're going to be turning these, or in consultation with the governor's office, if we're going to essentially turn off bypasses. And so the timelines would really be tied to that. I can say with the functionality that we're building into the system is we are making it so that when we turn a bypass back on, families that are already on the wait list would be notified that bypass is now available, just in case they may need it. So those are really the only populations that we can notify, because otherwise it would essentially just be notifying everyone in Oregon that the bypasses are being shut off. But we know when we turn a bypass back on, very specifically, that could impact families that were put on the wait list because they didn't get a bypass. So we do have that built into the system, and there would likely be media release and things along those lines if we are moving forward with turning bypasses off. And so this won't, just to note too, this won't affect eligibility of individuals who are currently on the program. One of the pieces, though, I said we have a bypass of those who are reapplying for ERDC. That's not really treated the same in the system as something that we can turn on and off. But the other ones, for people who would be newly eligible for the program, those are the ones that would be able to be turned off with this change.
Okay, maybe you can't see my hand. This is Annalise again.
Oh, sorry.
Nobody's speaking. That's all right.
I wasn't sure if you had re-raised it.
Yeah, no, I re-raised it. So our union's position, and we will be providing public comment on this testimony as well, is that if Delk is going to give itself discretion and write that into rule, Delk should also be passing a rule or rules about the requirements for public notice and what constitutes acceptable public notice, and what that requirement will be, And then also notice of timelines and requirements for timelines. Again, we are very concerned about the impact of how this rule will play out and the discretion. We understand, we've heard that the legislature is most likely to act, but that's not what this rule says. This rule says, because the legislature has the authority to pass a law or do what it needs to do. And we know that outside of a session that the legislature is not going to act outside of a session. So this is really a rule about DELC having ultimate discretionary authority to impact people's lives. The wait list is already gross and completely unacceptable. We understand that DELC does not have the ability to fund itself and that this is a legislative issue. But we are opposed to this rule without some stopgap measures, some cushion there. The standalone rule is not we are opposed to it.
Thank you so much. We have, I think Vanessa was next.
No, I believe Ivy has been waiting a bit
Oh,
longer.
okay.
Go ahead, Ivy.
Thank
Ivy?
you so much. Hi, Ivy, she, her pronouns with Family Forward. Yeah, we have very big concerns about this rule change. I mean, the whole point of allowing these exemptions and bypasses is to make it then easier for these vulnerable communities to then have access. And I mean, if you all are concerned of just like the number, but the number shows the need for childcare. And then just by being able to say like, oh, we're lowering the number because we're just like deactivating or activating the bypass doesn't then show the true need, which we know is there for childcare and childcare access. So very much echoing also Annalise's concerns of like DELC having this discretionary power, knowing that it's you all as a team would not want to do it without some notice or input, but we can't guarantee that will be the same leadership choices in the future. We know that from giving just authority. We're seeing now, right? I guess what I'm trying to say too, we're seeing right now, a government that's taking away eligibility when we ourselves are saying that that's what, and we have taken like the needs of that for our community with SNAP and Medicaid. And on top of that, we are like, this I think will only just cause more panic for families. It'd be like, oh, and now also childcare. And it doesn't, and one of the things that I had thought was happening with DELC, maybe this is more the question than to ask. I thought DELC was looking at, because it has been 2 years, maybe some of those on the ERDC waitlist may not need it anymore. So I thought you all were going to go through a process of giving notice to families saying like, hey, do you still need to be on this waitlist or do you not? And that was a way to show the true number of who is still needing to be, who is still active. And granted, that number is not going to go away just because we created those bypasses for families because they need that access to childcare. And we're just then lowering the number because we just remove a bypass criteria that's then not showing the true needs. And that like what we're needing our community for affordable childcare.
Right. So the families would still be able to go on to the wait list. So it wouldn't actually decrease the number of families showing to show that need. It would just mean that these populations wouldn't be able to bypass and go on to the actual program itself. I agree that these are very vulnerable populations. I've worked in child care policy since 2011, and I was involved in helping to add several of these bypasses. We worked very closely with child welfare to come up with trying to narrow down this bypass to the most vulnerable populations and how we could help the families the most. And so this is not something that we're taking lightly. This is truly just the fact that we have not been given sufficient funding to support the program. So we can't continue to support the program as it's currently functioning. So I completely agree with a lot of the things that you're sharing, but just to note that this would not decrease the number of families on the wait list. It would actually make the wait list grow faster if bypasses are turned off. So that would be the impact that we would expect to see. And Vanessa?
Hello, I'm Vanessa Broadley. I work for the South Coast Regional Early Learning Hub, one of only 3 regions that actively have Baby Promise. And not only do I see this, if they were to turn off bypasses for either Head Start funded or ERDC funded programs, we as a program would no longer exist. ERDC is a complete requirement that is needed for Baby Promise, and we serve families in rural frontier Oregon where this would mean the closure of providers that rely on this funding. And we are struggling to keep hospitals open, schools open due to lack of workforce. We recently had one provider, well, we've actually lost 4 providers in the last 6 months, and the ripple effect is still being felt. And again, we know that ERDC does not truly reflect the true cost of childcare. So with these programs that we're trying to supplement, it's just the ability, again, I'm going to echo what Annalise shared, that this uncertainty of, hey, how much heads up, because it's the businesses, the employers, the work, childcare isn't just a social service, it's an infrastructure. And we are teetering here on the South Coast.
Thank you for sharing that information. I think Ivy, you were next.
Since I've already spoken, I'll let Yessie go first, and then I'll follow up.
I just want to, first of all, my name is Yessie, and I run an outdoor preschool here in Southern Oregon. And this rule, or the decision to create a rule to turn off these exceptions, seems like a completely absurd approach to me. We're talking about, the folks who are on the wait list are already a vulnerable population. So you're talking about creating a rule to then decide which of the vulnerable from the most vulnerable to no longer deem worthy. And I just don't see where that's like creating a long-term rule to be able to do that. It just doesn't feel like something that should even be within question, honestly. And then the ripple effects and everything that goes along with it. Yeah, that's all I have to add. It just seems absurd to even be discussing it, really. And the fact that it, ultimately just creates the wait list getting longer when the real issue is a lack of funding.
Right.
It doesn't do anything.
Thank you. And Ivy?
Yes, 100% agree with that note of, and also to the intent what we had for these exemptions or bypasses when DELC was first formed, and we made that in 2023, was because we had identified these groups as the most vulnerable. So then they should have an easier time without more hurdles to then get access to childcare. And so to then remove that during, I just feel like this time or even in the future is against the purpose and values and also what we had hoped for. And for us at Family Forward, we want to see universal childcare, and like we see that through making an easier process for families to get childcare is the need, and that it's not the programs full or how you all are running it. It is about the funding and the state legislature. And so that's yeah, that's where the issue lies.
Yeah, and that you bring up a really good point. And the waitlist was initially created back in 2010. It was mirrored after the Oregon Health Plan standard waitlist. If y'all remember when OHP had a waitlist for basically non-pregnant individuals and non-children to get on the program. So it was created mirrored after that. There was very little that was done to alter its functionality over the years. but the initial bypasses were really just for those reapplying and for those who had left TANF benefits. And then the additional bypasses were added over a span of, goodness sakes, trying to think of when the baby promise exemption went, and that was the last one, but most of them went in over a span of probably about 6 or 7 years, where the wait list was implemented almost like 8 months out of every year. That was around like, I think it was somewhere around like 2012 to 2016 or so. The last time we had the wait list implemented was in 2018. And at that point, we had pretty much all of the wait list exemptions except for the baby promise one. And then we went a few years without needing a wait list, which was wonderful, but there was also no functional changes that were made to how the wait list worked. And I mean, if y'all have been following the ERDC program and all of the expansions and things that have been done to make it work so much better for families over that time period from 2018 to now, the program really changed a lot. But the waitlist functionality didn't change in order to match it. So there's really kind of a disconnect between the number of families that we're able to serve with our funding and how the waitlist and bypasses are allowing families to access benefits when they're considered vulnerable. But I completely agree. These populations were identified because we had decided these were the most vulnerable populations and we needed to allow a bypass. So that is why those bypasses were created over the years. And so I completely agree with that. And Annalise?
Yes, Jennifer, I do agree, and I think our union would agree that what we have here is it's not a problem of a wait list. The wait list is not the problem, and I don't think we should try to blame the wait list. The problem here is that the state of Oregon isn't funding public assistance, and they're robbing from the public assistance, at least the federal money, and spending money on other things which have necessitated a wait list. And the legislature was allowed to grow a program that it could not afford and it could not cash a check on. So I understand that that we're here talking about a rule for the wait list, but I think it's disingenuous for anyone to say that the wait list is the problem. As Ivy said earlier, the problem here is that Oregon has written a check it cannot cash. It is not funding childcare for people that are working and need public assistance. It is funding essentially childcare and preschool for children, parents who do not work. We've got some problems, and those are the things that really should be addressed, not using the wait list to come after families who are more vulnerable than other families that are currently getting funding.
I'm confident that we've gathered all of that feedback. Just noting time, we are about halfway through our time. Okay, go talk to Bob. Sorry. So we're going to move on to some of the other rules. If you guys have additional things that you want to add in the comments or share out with you, we're hopefully going to have some time at the end. Right. So moving on to the next rule. So this is about verification requirements. So these are specific to the verification requirements that are needed for the ERDC program. And the changes that are being made are really just clarifying what acceptable forms of verification are, including medical documentation and when self-attestation is allowed. And oh, sorry, I see a hand. Florinda?
Yes. My name is Florinda. I come from Mexico and living here. I'm trying to help. Maybe I can advise something. I understand that you are trying to review this for the year is coming. But my question I have about if this document is already done. It's done, and then you're trying to review if all is okay, or if we have something to arrange, maybe? Is that about that you are doing? Can I understand?
Yeah, so for the process for rulemaking, we're sharing this out in this public setting, and then we'll take your feedback and see if there are changes that we can make to the rule to make it better. There's also going to be an opportunity for a public hearing, but the public hearing, we don't really get to have the conversation. So it's just essentially people sharing their feedback and comments, and then we take that into account before filing the final rule language. So this is draft rule language. It can change. It can't change significantly, but we can make certain changes on things if needed. So and I don't know if Kate, you would have a better explanation of the rulemaking process, but that's my understanding of how we would how this
I'm
will flow.
saying because as educator, also participating in evaluation. At the end of evaluation, we can see that if we really did what we write, or what we promised to do, and then if something is wrong, we have to amend them and then make it better. That should be. I thinking about the list, whiting list. I thinking about this some calculation that I could see, but I don't know if this could be flexible. If talking about the special education, and you talk a lot about special education, and that's is very good because I think sometimes we have a kids that they need more attention, and we as a humanity we can focus more in them and try to make he go in competition, and could be better. Uh-huh. That I think this point is really good. Thank you.
And I noticed we do have some of the coding language in here, but just to share a little bit about what's changing in this rule. So specifically, we'll be updating the piece or clarifying about special needs age and when it must be verified. So in our processes, we ask our eligibility staff to gather this information both when someone is first applying for benefits and when they're renewing their benefits. But it wasn't clear in rule that that was something that was needed. So special needs age, just to let you know what this means, this is continued childcare once a child has essentially aged off the program. Children can stay on the program through the end of their certification period when they turn 13, but there are some circumstances where kids need additional they need childcare later, whether it's due to like developmental or medical issues, but also with special needs age, we see, as you can see in here, it talks about other circumstances. So very specifically, some of the situations that we've seen are a parent has a 14-year-old or 15-year-old child and they work a graveyard shift, or we've had parents who their children would have to walk home and it was a very dangerous neighborhood and their kids were getting harassed by people in the neighborhood. Another situation was someone whose house was recently broken into and they were really uncomfortable leaving their children home alone. So there's a lot of flexibility in when this can be applied for older children. But this is just specifically saying that we need to re-verify that at renewal. And then it's also clarifying that self-attestation is basically the parent just has to tell us. They don't have to provide us some other form of documentation. They just say, this is my situation and this is why I need childcare. So it clarifies that self-attestation applies to special need age with those other circumstances, like the examples I gave. And then the pieces of how to verify special needs age and special needs rate were in a different rule. And that didn't make sense for it to be in a different rule. So we moved that over to this verification requirements rule so that all of the verification requirements for the program are in one spot and it's easier to find. So we did find that piece on the special needs rate verification was not in the correct spot in the rule set. So special needs rate, that does kind of, it can do both, but it pays a higher rate for children. Essentially, it's equal to about the infant rate, but that's when children have a higher a need for level of care. So that's when it would apply, and that typically would require some sort of other documentation, like medical documentation, or things along those lines. And then essentially these are just the changes to the rule are clarifying the processes that have already been in place for many years. That some of these things are built into the one system, and like that annual verification is required, but it just didn't say it in the. So that's the purpose for this. This one was a little bit more of a cleanup rule, rather than making any significant changes. But I do just want to stop for a second and see if there are any comments or feedback. Okay. And so 0030 for general financial eligibility. This isn't very exciting. This is again some cleanup. So the rule is being updated to add specifically medical savings accounts and health reimbursement arrangements, along with health savings accounts as additional examples of types that must be considered when determining if income is available, and in defining the types of earned income. So before, when you would read the rule, it would give examples of just flexible spending accounts. Like that was what was listed as the example. But flexible spending accounts aren't the only type of account like this. So there are multiple other types, and it was confusing for staff when they would see just one example given when there are multiple other types of accounts that fall into that same category. And again, this rule change, this is just clarifying if you plug any of these other types of accounts into the system, they're already counting in the same way as flexible spending accounts. So this is making sure that the rule is aligning with how we're currently processing things and making sure that it's clear with additional examples given. Checking to see if there are any questions or comments on this one. I think there was something that popped up in the chat, but I can't see it. So I'm wondering, Tara or Alma, if you can.
Yes, it is from Natasha, and it's asking, can HSA and MSA funds be used to pay for childcare costs?
I don't believe so. So I just sat through a flex spending account webinar with our public employees benefit board yesterday. According to them, they were saying that only childcare, and this is okay. I will give the caveat that I am not sure across the board, but with the state flexible spending accounts that they had a medical one and a dependent care one, and you couldn't use the medical one to pay for dependent care. So that's what I know about our benefits, but I can't say if that is like a if that's a rule for IRS or how those are used overall. But my understanding is it would specifically have to be a dependent flexible spending account to cover childcare. Okay. I don't see any hands, and I didn't see any other.
I don't see anything else.
Depending on which screen I'm looking at, I might see the comment when it pops up. But really
continuing with Natasha, she's asking also, she's says, I'm confused why it would count for income source for ERDC eligibility.
We have a variety of different things that are counted as income for individuals. I would have to look into how exactly those are listed out, but there are some types of income that aren't counted and some that are, but flexible spending accounts, because it in many cases, it can be money that's diverted into an account. it's just counted as gross income. The employment related daycare program typically counts gross income. It doesn't give any deductions. So it's not like the food stamps or SNAP, like it will give deductions for something being earned income. It gives deductions for paying rent and utilities, and it's much more dynamic, but ERDC is really just looking at gross income for the individual. I hope that helps. And I thought I had seen a hand, but I may have lost it.
None. I don't see any more questions.
Okay. All right. So moving on to the provider eligibility and standards. So we have a couple different changes that are happening here. So for part of it, we'll be moving those verification requirements for special needs rate that I had talked about earlier. They're in this rule, so we're moving them out to the rule that we already talked about. So that's the first change that we see. We're also changing some of the language around special needs rate, where the language said like the norm, and we were changing that to typically expected because that was better verbiage to explain when special needs rate would be applied. And there were a few other essentially language changes to make it more clear. Another thing that is happening in this is we'll be updating the rule with the new rate tables. So there will be some rate increases effective January 1st. And so that's an exciting one that we get to put in there. When you look at the rule, there is a PDF table. And so that shows the rates, and that's where the new rates will be. I think one other clarifying language is there was an example talking about commute time, and it was saying 2 hours a day, but 2 hours a day is the commute time that we would give for someone who is working an 8-hour day. So that was very specific to a very specific scenario. And so we changed it to the 25% of their like work or qualifying activity time. So that's how the travel time or commute time is added onto the family's case, is it's a calculation of just 25%. So we were adding some or changing that so that it was more clear rather than just having it apply to that one specific situation. We're not anticipating any fiscal impacts for the commute time or the SNR. There are fiscal impacts with the rate increases. So that's one thing that's a little different than the other rules, because we haven't reported any other fiscal impacts, but rate increases will have some fiscal impacts to the program. But that is necessary in order to try and make sure that families continue to have access to care. Okay, Annalise, yes.
Yeah, so the rule is moving away from a per day to 25%. So is that the application of that going to be 25% for the total for the total work hours over the course of the month? Or is that going to be 25% of the hours that are worked for the day?
The calculation, how it works is it takes their final authorized hours, and then it adds 25% onto it. So we've done a lot of changes to how we authorize hours, but right now, if someone is working or in school or participating in something for 20 hours or less per week, then they would get a part-time monthly authorization. So the part-time monthly authorization, I believe, is, oh goodness, is it 86 hours, I think, is what that would be. And then we add the
Yes.
travel time on.
Yeah, 86, and then with travel time 108.
Yes. So it does like a 25% calculation to that 86. The full time, so anyone working over 20 hours up to 40 hours a week, they get that. Comes out to 172 hours per month, and then you add the 25% on, and that bumps it up to the 250. So it's not really, it's just a total for the month, not a per day calculation that's done.
Okay, so thank you for answering that. We'll provide some public testimony, and we have several examples of how this will have a fiscal impact. positive for the state, negative for certain families under certain situations that are already experiencing issues with having enough hours for travel time. When they work fewer days, so they're part-time or full-time, and they work only 2 or 3 or 4 days out of the week and go to school, but they only perhaps so they need full-time or part-time hours and this is especially is affected. They have full-time or they have part-time hours. They have but they work fewer days in the month or go to school fewer days in the month, and so they're disproportionately affected, and we can provide examples for that.
I would appreciate that. We also do have a policy in place where if people have a need for extra commute time. So like say their work or their schooling is particularly far away, we can add hours in for extra commute time. So that's just outside of the standard calculation. So if there is someone who needs additional commute time, I would definitely encourage them to contact their office to see if they're eligible for more hours for the commute time. Just checking. I don't think I saw anything pop up in the chat, so I'm going to go ahead and move on to the next one. So with the high needs child care payments, this rule talks about how the calculation is done for the supplemental high needs payment, and that's something that's added to the base payment. So it's not part of the maximum ERDC rates. This is an additional payment on top. And so basically we're moving some existing eligibility language for the supplemental high needs payment from the previous rule from 0075 to this rule, so that all of that pieces about the high needs will be consolidated. And then we're adding also a requirement for a written plan to be dated within the last 12 months. And so there are flexibilities if there are delays in getting the written plans, which we've seen that happen. So that's why we added those flexibilities in. And then it also requires the department to review the high needs payment rate annually, which I believe is done anyway. Again, this is just adding that process piece into the rule. And there, we don't have any fiscal impacts anticipated by this. We're not changing anything about how the high needs rates are calculated, so we don't anticipate to see any changes in that. And just want to check to see if there are any.
I don't see any questions.
Just a time check too, Jen. It's 6:51, so we don't have too much more time.
I think we're just at our last slide here. So this is where we're at in the process so far. So we have we presented these rules to the early learning, or we will be presenting the rules, sorry, to the Early Learning Council in November. These are a little bit out of date order, but we have our RAC today, so that's where we're at on the 15th. Before we present those rules, we're going to have our public hearing on November 12th, and that's from 5 to 6 p.m. And again, that's open forum for anyone to call in and share whatever testimony they want to share. We can also accept written testimony, so that's another piece as well. The written testimony would come in through that public comment period, so it would have to be received by November 28th at 5 p.m. And then we'll have the rules presented to the Early Learning Council for a final vote on the 10th of December, and they would go into effect on January 1st. So any questions about the timelines or anything?
I don't see any. I see no questions.
All right. And, oh yes, and thank you. It looks like Kate popped some links in the chat there. So if you're interested in like the public comment form and things along those lines, those are available for you. And just checking, are there any other final questions or comments? All right. Well, thank you all so much for your time and for your feedback. And just taking your time out of your busy days to come and join us. It's much appreciated.
Have you heard about that the president offered help about money for daycares? Have you hear the news?
Yeah, please stay on and we can give you some direction on that.
Yeah, because I hear a news maybe after yesterday, before yesterday, and I heard about he increased the loan for why or do more daycares or could pay more advisors or teachers because there are a lot kids bottom. You think so?
Oh, sorry, I misunderstood. I thought you were talking about being reimbursed for your time here today. I haven't heard
Okay,
about
maybe I can say that the president talked about that will increase the help, the economic help for early teaching.
Oh,
That's I say that's I
Yeah,
say.
Florinda is correct. It was an announcement, I believe it was yesterday,
Yeah.
that the feds are proposing an increase for fiscal year 2026 for the CCDBG of $8.83 million, which isn't gonna, or excuse me, $8.83 billion, which would be then prorated across the states. And if we can get out of shutdown, perhaps that will happen. And then the feds are looking to invest in 12.36 billion in that same year, fiscal year, for Head Start, as well as increasing the child independent care tax credit. So yeah, I mean, there might be some good news,
finally.
maybe. And but that, based upon the current ratio that Oregon gets, the current share of that Oregon gets, that would not be enough, or that would not be sufficient to remove the wait list at this point. So, I mean, it's good news, but I think it'll create in Oregon at least more chaos in trying to figure out how to figure out the wait list. But it might mean that you don't have to use your new rule to eliminate families' exemptions.
It's for they can do better. Maybe the families is gonna be good. These benefits is for help family. I think so.
I know our Child Care and Development Fund administrator is watching everything at the federal level very carefully. So if there is good news, hopefully we'll be able to share that after the shutdown when that ends. Thank you so much.
Okay.